Healthcare Ethics and Medical Law, Professor Jeff Kingsbury. Moral Right to Healthcare, Kari D Presentation. Do we have the moral right to healthcare? This is a question that we may never have the answer to. Our healthcare system is constantly changing. Laws are being introduced and the price of care is on the rise. There have been many attempts to create solutions to healthcare disparities, but it's not as easy as it looks. When we are being cared for, we have the right to the best care possible. We have the right to be treated equally despite our cultural differences and the right to honesty. But does this mean we have the right to care? Medical malpractice. Medical malpractice is when any healthcare professional creates harm to their patient as a result of action, a lack of action. This includes wrong diagnosis that results in lack of correct treatment that may cause harm. Medical mistakes are different than medical malpractices. Medical malpractices must have negligence. 160,000 people die a year from medical malpractice. Patients have the right to be treated correctly. Physicians have the obligations to follow the procedures and trainings that have been given to them in order to provide the best care and the correct care possible to the patients. Culture competency. This is a training that every healthcare professional is given. It helps a professional understand how to care for patients with different culture differences. Culture is one of the most important areas in a clinical relationship. Understanding cultural competency will minimize the negative consequences arising from culture differences. Understanding different cultural views is extremely important and plays a huge role in diagnosing a patient. Patients have the right to health care and respect regardless of their cultural and cultural views. Cultural competency is one of the most important things for healthcare professionals to be educated on. Different cultures changes the perspective of the patient. Therefore, it is important that the professional understands the cultural difference that they're working with. The Stark Law. The Stark Law prohibits physicians to refer patients to other facilities that they have connections with. This helps control unnecessary imaging, testing, and other services. Physicians must have the patient's best interest at mind when doing referrals and refrain from referring them to a facility that will benefit them first and foremost and not the patient. The Stark Law also keeps the healthcare competition fair. Patients have the right to honesty and fairness in regards to their healthcare. They have the right to be referred when necessary and to be referred to the best facility for their circumstance. There are several laws put into place to protect patients' right. The right to being cared for with honesty, treated equally, and given the best care possible. However, this doesn't mean that we morally have the right to healthcare. Healthcare is a privilege, and although some type of universal healthcare would be nice, it just isn't something that we can offer at this time.